Good evening, ladies and gentlemen. Welcome to my show, Lifestyle with Dr. Moby. I'm Dr. Moby, and today we are going to talk about very exclusive topic. This is a burnout about healthcare providers, and the reason we want to talk about is for many reasons. I always emphasize that as healthcare providers, we really need to take care of ourselves, our own health, and that comes first. Or any healthcare provider recently, actually, with pandemic going on, it really proved that we really need to uh, work on ourselves in terms of health and take care of our stress, whether it's a personal or at the medical center or elsewhere. So today we have a great guest, and I will introduce you. And that's Dr. Jamil Ahmed. He is a practicing geriatrician, and he will be talking about caregiver stress. So let's welcome him today. Dr. Jamil, we welcome you today.
Yeah, thank you.
Okay, so tell us about your practice.
Well, I'm an internist and also working in the geriatric field,
Uh-huh.
and that involves, how complicated geriatric patients are,
Yeah.
and they have health issues and emotional issues, and not only that, the people who works with the geriatric people, they are also in a part of the team. So you see them, not only patient is suffering, also the family and the members and everybody around, how much support they need. Not only the patient, also the caregivers.
Okay. So the caregiver. So for audience, we just want to again emphasize by caregiver stress, we mean that for them to take care of balance between their personal life and their professional life. So whether it's about health or whether it's about psychological stress or whether those are difficult patients, that all is included. So we're going to talk a little bit about, if you can educate doctor about some of the statistics which you have prepared about these, how many healthcare providers are affected.
Well, if you just start with what is a burnout.
Mm-hmm.
If you just think of the burnout, it will be any stressful work, long hours, and then at the end you don't feel that you are satisfied, and then the burnout will come up. It happens in the professional life and also in everyday life, in family, husband, wife, and it doesn't matter. It is the burnout can happen. There is a simple definition for this, is that it not only affects the physical effect, it has an emotional effect, and also has mental exertion. So what happens is that when you have stress like this, your positive feeling ultimately turns into negative. It doesn't matter what happens, you always try to latch onto the negative side of the story. And if you are to decide what happens in the stress, there's a few things happens. Number one, you can tell that there's role confusion. All of a sudden, if you suppose you're taking care of older people, and you never did that before, and you're told that you are a caregiver, that will be change of role that you're not prepared for. You're not trained, and it will be very difficult. Almost 65% of the caregivers for the older people are female. Female means daughter and a spouse. Men usually don't. Sons are involved, but close to 5%. So next thing is lack of control. Suppose you don't know what's going to happen. We always think about that we have a plan. For taking care of geriatric people, you don't have a plan. What is going to happen tomorrow? How are you going to behave? So that makes it difficult, causes a lot of frustration, and also has issue with the money. When you take care of some older people, and it's almost like a 20-hour job per week, at least, and also it's a 7 days job, not 5 days.
Yeah.
So it's a lot of hour involved. So there is issue of money. Either you have to cut down your work or you did, or you have a problem that you have to quit the job completely to care of your elderly parents. So that causes a lot of issue with the control, and that causes a lot of agitation. So how we think that how they're going to manifest, they're not going to be telling you that I'm stressed out.
Okay.
Do you have any question?
Yeah, I think what I want to ask is, what do you think is hardest part about, like you mentioned, there are some females taking care of those other daughters or wife, right?
Yes.
And you think it's hard because they see their loved ones in such a shape that they have to take care 24/7, like you said.
Yes. And that is, of course, the point, but there's also a lot of satisfaction, but there's no reward to it.
Yeah.
And we always work, if I have a reward, you can, but you don't see any reward. It's a day in, out, it's the same thing. And so how would you know that you are going into this depression phase or a burnout phase? There's a difference between depression and a burnout. Usually burnout people, if you take them off the situation and tell somebody to come and help, the burnout will get better.
Okay.
For depression, it's going to be continued. It doesn't matter what happens. It is much more emotional and internal issue. So you cannot take the depression away, but you cannot make burnout better. So the way you tell that they are going into burnout is that they'll stop calling your friends.
Or they stop.
And they're isolated. They don't want to talk. And they have lots of interests. Suppose they want to do watch television, they stop doing it. They love to do knitting, they stop doing it. Same like they will do in a depression. And another thing happens is that they can get depressed to the point that they can contemplate suicide.
Oh, okay.
And they get very anxious, and they will also have a change of appetite, exactly the way you see in a depression. They'll change of appetite. Some people will gain, some people will lose. So they became very irritable, and sometimes we call them short fuse.
So they will be having problems at home.
Yes, problems, and so the husband-wife problems. They will not be interact well. So it is a major issue, and it is. Even now, in this COVID-19 situation, people are getting stuck in one place. You can see that people are more restless. They are having more trouble in the family. Yes.
And so I think, I was discussing once with psychiatrists, and they had a great kind of analogy for these people. They say normally husband, wife, or anybody, it's like a pressure cooker. And then they are nobody knows what's going outside. But when with all these stresses, and there are blow valves like whistle, but that is safety mechanism is gone with current situation, and so the people is putting lot of stress on their lives. They have to quarantine together. Yes. They can't go. So those meeting friends and those are gone. So same you have mentioned, I think, quite nicely about people differentiate between depression and burnout. So some features for depression will be present, but not to the mark of depression, right? Full blown. Yes. So one for spouse or loved ones to notice that he or she is not meeting friends, or their normal routine has changed.
Yes.
Maybe the food they like is not the same what they usually enjoy, so their daily routine has changed to some degree, right?
Yes.
And what about sleep, you think?
Oh yeah, definitely. And that is one of the, when you say what to do with these people, sleep is one of the things that you always tell that you have to have 6 or 8 hours of sleep, irrespective of. It's not only affects you emotionally, it also affects your immune system. And when you check these people, when you have infection, they have less antibody production. And so they don't fight back infection as vigorously other people. So they tend to have more infection.
Yeah.
So that is a very interesting thing.
Okay. And also, so what help do you think they should seek, or do they have any kind of support group, or what do you think that would help?
Yes, that is definitely is one of the things.
Mm-hmm.
You know, just to say that, to make people understand that, most of the people would understand that how badly they feel. There is a saying that say that, caregivers are often the casualties,
Oh, yeah.
the hidden victims. No one sees the sacrifice they make. When they feel that way, that makes things even harder, I'll say. And it is an expensive proposition. Like in Alzheimer's disease, taking care of them cost over $100 billion per year. Just Parkinson's costs $28 billion. There are other diseases like cardiac disease, heart disease, and diabetes, and multiple sclerosis. There's also cost a lot of money. But caregiver gives 40% of that money worth of work without any pay.
Oh my God.
So that is a tremendous support they give and don't get paid for. And
Yeah,
we
that's-
expect.
Yeah, yeah. And that is true, that they do, and for us as a healthcare provider, is lot of things we do, and the only appreciation we seek is actually seeing people get better or patients get better. It is we don't get any monetary, or there's nothing that can give reward for that service. It is what we love as physicians.
Yes.
So you're absolutely right. There are so many things we do as a physician. That's why probably we are in this field, because it's a thankless job, and many
That's right.
times it's not for money or any other gain. It is just we love humanity, and we love countless hours of service. So let's. What makes you, doctor, go every day and night to help people? What makes you strong?
I think that one thing is social expectation, and who's going to take care of the parents other than their kids?
That's
They
true.
they do. Now the family has changed, their financial issues has come into play, so sometimes they cannot do that, and they feel guilty, they cannot do this. That's also a problem. And but most of the time they do is a labor of love.
Yeah.
And so you expect that a child will take care of the parents, and it's a hard job. But you can do few things, as you told me. That what can you do? Well, few things has proven that it will work. Like call your friends and ask them that I need some help, or call your family member, your siblings, and say no, it's getting very tiring. I need some break, and sometimes they will pitch in, sometimes they may not. In case they don't pitch in, then there are other services that you can get involved, like they call respite care. Respite care is a program that is covered by most of the insurances, and that is involved that you can keep your parents or a family member which has a lot of disabilities, and into a nursing home or skilled care facility, or a assisted living situation like a personal care home, which is usually covered by insurance for 14 days. And we should make a routine to take advantage of this problem. And every time 14 days you go for vacation, then think about nothing, because you have to, otherwise you go crazy.
That's true.
And then you have a home health that can come and work for an hour. For 1 hour, you can go home, out and get out of the situation completely. But I know that your mind will be at home to make sure that they're doing well. And then you have the clergy that you can talk, and you can talk to the home health services, as I told you. And aging service has a lot of program. Like you can take them to There's services like you can go activities for a few hours that you can get in there, and they'll stay there for a few hours. That few hours is yours. That you can go to bank, you can go for shopping, because taking care of is not only sitting down and with your parents. It involves running errands, shopping, cleaning, bathing, cooking, and giving medications.
Yeah,
It is
that's a full time.
it's a full-time job. Even though it says only 20 hours, I'm sure it is more than that. And it's 7 days a week. And you have to educate yourself. There's a good book called 48 Hours Day. And that is a good book that I always thought that is a good learning plan for people who getting into the situation where long days will be involved. And as I told you, that sleep is a must. You have to sleep, because if you are not sleeping, your next day will be very depressing, exhausted, and your attention span will be much less, and you'll be angrier faster. And you have to understand that some days you will feel that way, and to accept that some days I will be terrible. I'll be not expecting. I'm blaming everybody for everything, and that is natural, and this is not a wrong thing to do. Another thing is that there is a lot of caregiver groups. You can call them up and tell them, I need to join you. Then you can join them and ask them, how do you solve this problem? When your parents don't sleep at night, what do you do?
I do. Yeah.
And so they will give you a lot of tips and the things like that, what they do. And there'll be someone you always can call and talk. That also helps with your venting. And you should know what's your limit. And then when you get to that limit, you step back. You have to step back and think, what will be my next day?
Yeah. So I think those are very important points. So for audience, just make sure, take care of yourself. Number one. Number two is identify if when it is your limit, and you don't push yourself through. Nobody is Superman or Superwoman, and we all have limits. And realize that you need to sleep, eat, and take care of your routine. And there is emotional support. Seek your loved one, friends, whatever relaxes you. So you need to break up this cycle and give in between some relaxation for your mind and body. And if you are a spiritual person, if you seek spirituality, feel free to do that. But put that in to get you going for next. So it's make sure it is organized. So first thing is keep an eye on your behavior. So if your loved ones point out that your behavior has changed a lot or some, admit it and look into soul searching and make sure that you are honest to yourself. Actually, it's going to help you, not harm you. Nobody is here to criticize anyone, but you look at and help yourself. So that, and you will see that your mind is, I always tell people and patients that look, mind is like a computer, and the computer works best when different parts of computer work in synchronization, not at all firing at all cylinders, because it draws a lot of current from the hard drive and can burn the hard drive. Same is human brain. It works best when certain portions work and certain rest. So if the whole mindset is geared to emergency response, it can burn out. Those hormone, adrenaline, put a lot of stress not only in the brain but also in the heart. So elevated blood pressure, heart problems, unfortunately a lot of heart disease related to type A personality, as well as health effects. Recently, actually, a lot of physicians fighting pandemic lost their lives too, because they were not taking care of their own health, which in terms of diabetes, hypertension, and health. So unfortunately, for many years, the most of physicians are actually worse patients. So, and including myself. So make sure you are taking care of yourself, your health. Realize that burnout is a reality. So seek a support group. Make sure join them. There's no shame in or no harm in, and discuss those things which are stressing you. Maybe they have a better answer to some of difficult patients or difficult situations we are seeking. And regarding family, I think doctor already mentioned, make sure is get a support from whole family members. Make sure they are not having problems in taking care, and for them to realize it's a full-time job. It's not easy, and it involves a lot of care. It's a teamwork between family, us, and the intermediately staff. So that's a 24/7 kind of job. So make sure we all take care of that and stay healthy and stay focused. So for final wrap up, I'll request Dr. Ahmed, any summary or pointers you'd like to share with the audience.
Well, I think we should give more credit to the people who takes care of our family member.
Yeah.
And 85% of all caregivers are the family members. So, and all the caregivers, 40% have emotional stress. It's a big number.
Yeah, big number.
And 20% are in financial trouble. And 20% are physically stressed. So they have more physical illness and stress and things like that. Not only that, it has involvement of our body, like the cortisol level of patient, or the caregivers are 15% higher than normal people.
Wow.
So and high cortisol level is implicated in a lot of medical problems like high blood pressure, diabetes, coronary artery disease, and stroke. So it should not be taken lightly. That's my final word.
Yep, and I think with these thoughts, we just want to again summarize for audience that look for caregiver stress, look for loved ones, take care of your loved ones. It's a team effort. It's not one person's job. And if we all share and we realize it's a team effort, it makes that job much easier to understand and handle, because after all it is our all loved ones, as well as, and the caregiver provider stress is actually a big fact. There's also actually a study before that in residents, they were being overworked and they were noticed to have a lot of mistakes, and that's another topic. We can talk for hours on that. So make sure you take care of your diet, you take care of your sleep, you take care of your emotional support, and seek any help if you need. So with those thoughts in mind, we will like to get feedback about our program. So send us a Twitter, Facebook, email. So keep watching Lifestyle with Dr. Moby, and this is Dr. Moby and this is Dr. Ahmed. Thank you, Dr.
Thank you.